Greetings and welcome to In-Depth. I'm Dike Rostant. The 22nd edition of Vaccination Week in the Americas 2024 was launched this week under the slogan, "Engage now to protect your future, #GetVax." Manager of the expanded program on immunization, or EPI, at the Ministry of Health, Grace Sookchand, she joins us now to share more. Thank you very much for joining us, Ms. Grace. Now, I know that this is the 22nd edition, but when we say a Vaccination Week of the Americas, what are some of the things that we're looking at?
So, a Vaccination Week of the Americas is an initiative of the Pan American Health Organization, which is a regional branch of the World Health Organization. And what they do actually is use this week to promote vaccines, to talk about the benefits of vaccines, but also to reach those persons who may not have had the opportunity to get vaccines. So it's about promoting, but also reaching the vulnerable and those that are unable to get vaccinated. We use this period to educate the population about vaccines, answer their questions, address their concerns.
And saying that PAHO is a regional body, and I want to bring it specifically to Trinidad and Tobago, and give me a little history about the expanded program on immunization. Thanks.
Sure. So the expanded program on immunization, again, it's a initiative for the World Health Organization, and this program has been in existence since 1974, 74 to 79. Around that time, it was developed, or this program came into existence, and that's when we started introducing vaccines in Trinidad and Tobago to the population. And this came about as a result of then diseases like smallpox that was, around. Ever since the initiation of that program, we have expanded the amount of antigens as it relates to the type of diseases that is circulated, and providing vaccination free of charge to the population of Trinidad and Tobago.
And with that, what are some of those diseases that have been eliminated or taken out of the system, as it were, as a result of vaccines?
So when we talk about elimination, off the bat we think about smallpox that killed millions of people, and that was actually eradicated. In fact, the last case of smallpox was in 1977, and not even here in this country. And then when we look at polio, regionally, polio has been basically eliminated from the region of the Americas. And we, because of our vaccination coverage rate, that is a success for us. Our last case of reported polio was in 1972, which is excellent. In 2015, Trinidad and Tobago, with the regions of the Americas, was declared rubella and congenital rubella syndrome free. And in 2016, Trinidad and Tobago, together with the region of the Americas, was declared measles free. So these are some of our success stories.
All right, and if the thing working so nice, if the success has been that apparent, what's the reason for encouraging persons to, get up to date with vaccines who haven't had some of these at all? What is the rationale behind that?
So, with the vaccination program, we have gains. But if we don't maintain those gains, then we risk resurgence of vaccine-preventable diseases. So it's all well and fine to say we don't have any cases. But if we don't continue to vaccinate the population, there is a risk of these cases coming back into the country. It could be imported. As you know, persons are traveling back and forth from Trinidad and Tobago, and therefore it puts us at risk because we have countries out there with outbreaks of diseases. For instance, there's a reemergence of measles in some of the countries of the Americas, and therefore that puts us at risk. Hence the reason why we encourage persons to get vaccinated. Vaccines protect you against diseases.
Now, you spoke of traveling, Ms. Sookchand, and that reminds me, there was someone who was very happy to hear, okay, well, yes, it's the week for vaccinations and immunization, raising awareness. And they were asking a question about logistics in the sense that they are trying to get the immunization card, but not everything has been digitalized as yet. That work is still ongoing. So if they can't find it because they went to one place and they went to another place, is there an alternative in terms of like the logistics so that they have their immunization card so they can move forward and do some of the other things they want to do?
All right. So if it is vaccines that this person may have received from childhood going forward, then basically once we have an idea of what their age is, depending on how old they are, some of the facilities do have records up to the early 80s, 1982, and that sort of thing. Older records may not be available because, as you know, as you rightfully said, we are not digitalized. We were not digitalized at that period of time. So those records may have been damaged or destroyed. However, what we want to assure persons is that even if you don't have a vaccination card and you're an adult, vaccination is not only for children. It's across the life course. So you can get your boosters of adult vaccines, which will cover you for those vaccines that you may have misplaced. You know, the card with the information that you may have misplaced as it relates to childhood vaccines. As it relates to the COVID-19 vaccines, we do have a database of persons who misplaced their card can go at any of the county medical offices of health to get that information. If they can't get that information, then they contact us at Ministry of Health and we track those records.
Okay, and if you get the boosters, does that supersede, or this is the adult boosters, or do you now have something that is digitalized that you can say, okay, well, here, this is what I'm working with, and you can move forward unhindered?
So as you said, it's a process. We still we're not completely digitalized as yet, but we are working to digitalize the vaccination program for Trinidad and Tobago. So very soon we will have that process in place. But we would give you a card, that, immunization card with your records, and we will have that records now on databases at whatever health facilities that you are being vaccinated.
All right, and that is where we want to take a short break, because when we come back, I want to talk about how it is people actually get vaccinated, how it is people get immunized, where it is the logistics of actually getting vaccinated. So we do that when we return. We are speaking with Nurse Grace Sookchand, manager of the expanded program on immunization at the Ministry of Health. Stay with us. We return after this. Welcome back. I'm really enjoying this conversation. I think it's so informative. We're speaking with manager of the expanded program on immunization at the Ministry of Health, Nurse Grace Sookchand. Now, we spoke a little bit. We set the groundwork context, but so people are very excited about getting vaccinations now. They want to be immunized. How does that happen? Where do people go? Is it hospital, primary healthcare facilities? What is the process, the logistics of it?
So vaccines are available at all health centers throughout Trinidad and Tobago, and we have 109 facilities that administer vaccines. That being said, we also have a partnership with some of the pediatricians who give vaccines as well. So apart from vaccines that they purchase and they give, we also partner with them and give them some vaccines that they distribute. So apart from the health facilities and doctor's office, we go a step further. The Regional Health Authority, in collaboration with Ministry of Health, of course, run campaigns, mop-up campaigns. So we go out, we use mobile units, we go and reach persons in remote areas. We organize programs so that vaccines reach the person, the client, the target groups that we are looking at. Apart from that, the district health visitors attached to the facilities also do home visit. So if a client don't turn up with a child for vaccines, they go out to them to ensure that those children are vaccinated.
And is that working from a database to say, okay, well, we see that there's a child in this household, but we're not seeing the child, or we don't have in our records that the child got vaccinated?
Right. So let me tell you how this works now. Every child that is born in Trinidad and Tobago is registered. The hospitals where those children are born, before they leave, they're given a letter to drop to a health facility. And that nurse, once she gets those records, she follow up with those children. Apart from that, every hospital sends out information. This child has been discharged. Mother and child has been discharged. The child belongs to this community. So what we do now is we reach out to those parents, whether they remain in the same area or they move, well, then we transfer the records to the other area. But basically, we reach those persons and we offer them the vaccines, offer them all the services. And as I said, if persons move from one area to another area, then we track those persons. But we ensure that, the population, the target population, are vaccinated.
And is it a matter of reaching out to say, okay, well, we have a grouping that would like to get this vaccination? Sometimes there may be corporate entities that they have a health day where people can get certain measurements taken, and vaccination is an option as well. But
Correct.
Do you go, or do people ask you to come? What is that process like?
So with the Ministry of Health, we normally get requests for these initiatives, and we send it out to the various RHAs. If the RHAs can't facilitate, in some instances, the Ministry of Health will come in and step in and assist. What the regional health authorities do, however, what the nurses do is that they go to places of work, they meet with all the NGOs, and if anyone indicates there's an interest in having vaccines, or they're having a health fair or some activities, they join in and partner with them and they offer the vaccines.
No, because we're raising information or raising capacity, knowledge about vaccines, let's bust some myths now. Are there things that you hear that people say or think about vaccines and they say, no,
yes.
It's not so? If that is the case, I see you shaking your head. So give us some of those
Yes, we
facts.
do. Unfortunately, we do. Like, for instance, one of the biggest one we have is that measles vaccine causes autism. Now, this has been debunked because scientific studies have shown that there's no connection or link between the vaccines and autism. And this has been debunked, even though it was mentioned before. Scientific studies and research have proven this to be wrong. That's one. Sometimes you hear if we take the vaccines, we might get the disease condition. That is also wrong, because the vaccines itself contains a small strain of either inactivated or the virus itself. And what that does is actually induced immunity in the person. So it prompts the person's body to produce antibodies, basically stated. If they're introduced to the virus, they have antibodies that's going to engage and protect them and fight against the disease. Some other myths that mentioned, trying to remember, vaccines are only for children.
Okay.
As we spoke about earlier. Vaccines is across the lifespan. They are not, it starts from childhood, but it continues because we still need to protect our population, our pregnant mothers. We still ensure that children who are below the age required for certain vaccines are protected. We still need to ensure the elderly are protected. And then we have vaccines like influenza and pneumonia for the elderly to protect them from diseases that can be very debilitating and even cause hospitalization and death.
And how do people find out a little more about, one, the work that you're doing, and this is at the expanded program on immunization, or just about immunization or vaccination in general?
So they can visit the Ministry of Health webpage. On the website, there is a part for EPI under the program Vaccination, and you can get all the information. You can also go to any of the health facilities and talk to a healthcare provider who will be happy to share this information with us. And it's very important, and we encourage persons out there to go to reputable sources and get your information. You go to the Ministry of Health website, you can go to PAHO, WHO, even CDC website to get correct information about vaccines and about the diseases that they protect us against.
And I want to thank you so much, Nurse Grace Sookchand, manager of the expanded program on immunization out of the Ministry of Health. You just spoke of PAHO, and recently installed PAHO WHO representative for Trinidad and Tobago and the Dutch entities, Dr. Gabriel Vivas Francesconi. He is currently out of the country, but he prepared a statement in observance of the week. Now, we go to that now, but on behalf of us here at TTT, this has been In Depth with me, Dike Rostant. Thank you so much for tuning in.
Good day. I'm Dr. Gabriel Vivas Francesconi, the Pan American Health Organization, World Health Organization representative for Trinidad and Tobago and the 6 Dutch Caribbean territories. Today, I'm here to discuss the crucial topic of vaccination and immunization. Immunization is an essential process that bolsters individuals' resistance to disease through the administration of vaccines, which are substances that instruct the immune system to identify and combat specific illnesses. The vaccines activate the body's immune response, offering protection against future infections or diseases. Immunization serves as a cornerstone in disease prevention, combating disabilities, and avoiding deaths associated with vaccine-preventable diseases like cervical cancer, polio, measles, rubella, and numerous others. New vaccines are continually being introduced worldwide, and I'm happy to report that 47 countries have introduced the human papilloma virus vaccines, or HPV, addressing a common virus transmitted through sexual contact that can lead to various health issues, including certain cancers. 37 countries and territories have introduced the pneumococcal vaccine recommended for vulnerable groups, including young children and older adults. 22 countries and territories have introduced the rotavirus vaccine, vital in preventing severe diarrhea and dehydration in infants and young children. However, disparities persist, with millions of children in the Americas lacking completion of basic vaccination schedules and some regions reporting low coverage rates for key vaccines. Nonetheless, PAHO continues its ongoing efforts to enhance immunization accessibility and effectiveness. So PAHO WHO Comprehensive Immunization Program aims to support member states in reducing morbidity and mortality from vaccine-preventable diseases through control and elimination strategies. The expanded program on immunizations, EPI, has been successful in providing technical support and guidance in eliminating and controlling diseases like smallpox, polio, measles, and neonatal tetanus, making Latin America and the Caribbean global leaders in immunization, including Trinidad and Tobago and the Dutch Caribbean islands. PAHO WHO strategic plan focuses on strengthening governance, monitoring and surveillance, integration into primary health care, innovative communication approaches, human resource capacity building, and evidence-based decision-making. As of 2023, the EPI unit of the Ministry of Health has reported impressive vaccination coverage: 99% coverage for the first dose of the polio vaccine and 96% of the third dose, 90% of the first dose of the MMR vaccine and 91% for the second dose, and 100% coverage of the first dose of the DPT vaccine and 96% of the third dose. Efforts are underway to further improve coverage to meet the 95% threshold for primary vaccines. Presently, initiatives are also ongoing to ensure that every child is immunized for preventable diseases and improve surveillance and enhance notification of suspected measles and polio cases. The PAHO WHO Trinidad and Tobago Country Office will continue its partnership with the Ministry of Health EPI unit to commemorate the Vaccination Week in the Americas 2024 by supporting vaccination activities in Tobago and other vaccination activities during the 22nd and 26th of April of this year. I encourage everyone to participate in these events, get educated on the importance of vaccination, and take action to protect yourselves and your communities. Remember, vaccine saves lives, get vaxxed.